and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course. Bob.
All right, is someone faking back pain? That's the big question
You're
here.
asking me?
I don't know. The thing is, this is not a definitive test, but it does help you start pointing that direction to determine whether or not they are faking. And we'll talk about this more, but it's called Waddell's, or it was invented by Gordon Waddell. He's an orthopedic doctor from Scotland.
Oh.
I don't know if he's still alive or not, but anyway, he came up with these tests, and they're not, does not mean if they're positive, and we usually do 5 of them, and if 3 or 4 of them are positive, then you start thinking, is the person faking, or is there an emotional component that's really enhancing their responses to your test?
They had a real bad experience and they're just so anxious that it's going to flare up or get that stabbing pain. It's like that. And this is usually done by a physical therapist, a physical therapist assistant. You can do it if you're not a therapist, but we're the ones that normally use this.
Right, we're the ones that see a lot of patients, so we start seeing when something seems a little abnormal, because I don't do these on everybody by any means. I'll start to do these if I start seeing something a little weird.
Right.
And I had 2, I'm going to give it just two examples real quickly. One, definitely person was faking. And I've only probably had 1 or 2 people in my lifetime that were faking.
Clearly.
Yeah, clearly. And the other person, no, it was an emotional component. She was abused as a child, and she just, her pain scale was always 20 from 0 to 10. I mean, just one of these people you could tell emotionally not stable.
Right.
So, all right. The first test that we like to do is called, why don't you go ahead and stand up, Brad? And we're going to go ahead and just put, all I do to the person is I put some gentle pressure on the head. Now, this is for back pain. So this, I'm seeing Brad for back pain. He's been acting a little strange. So I go ahead and I push down on his head really lightly. There's no way that even put pressure on his neck, to be honest with you. And yeah, your reaction, Brad? Yeah, it hurt my back.
Right.
So the second test that's similar to that is he's going to put your hands on your sides, down on your legs, and you're going to want them to kind of twist from the knees. And as you see from this, there's actually no stress on the back whatsoever, because the back's moving like a log or a rotation.
The arms are acting like 2 splints.
Right.
So that's, so it's all my motions from my ankle and my knees.
So there's no stress on the back at all, and if this increases their pain, again, it's a possible sign. So we're going to go distracted now, Brad. So everybody knows, like, go ahead and lay down flat on your back, Brad. A lot of people know that this is the test for back pain, for a sciatic nerve. You bring the leg up and then you bring the foot forward, and they'll have increased pain with that. So that's fine. If Brad has that, it hurts.
Oh, pain here.
Yeah, going down my leg. But then later on, when I'm treating him, I'll have Brad sit up, and I'll do it in the seated position, not even saying anything to him. I'll just bring the leg up like this, and he doesn't.
Problem.
Yeah, he has no pain.
Yeah, and scratch my foot a little bit.
Yeah.
Yep.
And if he had it laying down, he should also have it seated. Now, otherwise, that's not inconsistent, and again, there's an issue going on here. If the patient is telling me that they have like a sensory loss or numbness or tingling throughout the entire leg,
right?
Not front, not back, because usually it's in the back,
right?
And
all the therapists, we know the dermatomes,
right,
where the pattern of the nerve typically responds,
right? So if they have numbness throughout the entire leg, there's your sign. So
and there is that it?
No. The other one is that kind of falls in that same category. If we're testing their muscle strength, and this is one that it takes a little bit of experience to know, but when you push and something's weak, it just kind of gradually gives away like this. But if someone goes like this and all of a sudden they just give like that, that's not normal. Right. That's not how muscle strength usually gives away. The last sign is Brad, if they're just over exaggerating everything. Like I go and I just touch and they're just, so again, those are 5 signs you can look at. And again, does not mean that they're faking for sure.
Right.
But if it does, if I'm a surgeon, I'm not going to do surgery on a person like this. I'm not going to jump into surgery because this person's going to come out and probably still have pain because it's an emotional component. So that emotional component may need to be treated along with the back pain.
Right, exactly, huh?
So
So it's like if you have 3 out of the 5 are
3
positive,
or 4, yeah.
but if it's 5 out of 5, it's,
And
something is going on.
I had someone that had 5 out of 5, and like I said, one was a faker, and she ended up settling with
Insurance
yeah,
company.
with the
Yeah.
insurance company, and the other one, like I said, was an emotional component.
Sure.
So. All right,
Good
thanks
job,
for watching.
Bob.
Good comment below.